We are gathered here today to kick-start a very promising study on the establishment of longitudinal cohort study for prevention of chronic diseases, Indian study of health aging, in collaboration with Tata Institute and the Oxford. As we are aware that the disease burden of the cancer is increasing manyfold, particularly in the urban area, but we don't have any scientific data to rely upon the futuristic treatments. So we collaborated with the Tata Institute and Oxford to go for a cohort study and analyze that what are the factors, what are the symptoms, and what are the genomes which are responsible for developing the cancer prevalence in India and particularly in Goa. So for that purpose, we identified around 1 lakh population, 50,000 women, 50,000 men for a study. We will collect the data through our health enumerators from the ground. We will capture these in our boxes. The blood sample will be transported to the Tata Institute in Mumbai. They will freeze it at the state-of-the-art facility. They will analyze the data. Further, we are intended to go for genome sequencing, as our Honorable Prime Minister has time and again emphasized that Government of India, Indian population should be properly genome sequenced so that we can identify and detect the disease at the early stages, so that the casualty or death should be very fewer in these cases. For that purpose, because our Goa has a very widespread, deep-rooted health structure and health facility under our leadership of Chief Minister, sir, we are going and intend to go for genome sequencing also, sir. Under this study, I will request Dr. Dikshit also to emphasize on the importance of genome sequencing so that we move forward. For that purpose, sir, there is 3 slides. I will request Dr. Salkar to just give an overview of that. Thereafter, I will invite Dr. Sara and then Dr. Dikshit to formally tell about the study. Therefore, it will be open to the House to give their views. Then Chief Secretary, sir, will summarize, and finally blessings of the Honorable Chief Minister will be solicited this great study. And of course, and the government is sitting here, the Goa government is sitting here, the sovereign guarantee is here, and we will make it a state-of-the-art world-class study, and that will pioneer the research in India. Thank you, sir. I invite Dr. Sawant.
Do their all height, weight, BMI and other things, blood test, regular blood test. Then we will take a sample free and send it by 2 to 8 degrees to the Tata hospital, where they will freeze it at minus 80 degrees and they can store that for next 20 years. So anytime in future we want to do some study on the genomic or something, they can do it in that facility. So there are roles and responsibilities we have taken. DHS Goa, which is important that we will look after all the how to go to the respective households and collect all the data. CCA TMC will give a design study methodology, storing of that these, and in future suppose we want to do any studies, they will help us out. And Oxford University will give us a study design, support data analysis, will integrate some risk factor, enable research collaboration. Suppose tomorrow we require some funding, then all 3 of us can apply for funding, and so that we can give a grant for some particular, suppose we want to study some genetics in diabetes, or we want to study some genetics in breast cancer, then we can go back and take all these samples and study. So we will be having around 1.2 to 1 lakh to 1.2 lakh cohort blood samples stored at the biobank of the Tata Memorial Hospital. Thank you very much, sir.
Now I request Dr. Sara to come forward and speak about the role assigned to the Oxford University and how she will bring us out and help us.
Well, thank you, and I just want to start by saying thanks very much for the invitation to join you today and the very warm welcome I've received from everybody. So I'm a professor of epidemiology and medical statistics in Oxford, and I've been collaborating with Dr. Dikshit and Dr. Matre and their colleagues on the Indian study of healthy ageing in Barshi, providing, as we've said here, the sort of academic and technical support through exchange of knowledge and increasingly personnel, including students and population in the world. So it's just a wonderful opportunity for Goa, for India, for the whole of South Asia and globally to add, I think, important evidence to our global understanding of disease. And
Chief Minister, Chief Secretary of Goa, I think that this is a very historical moment, and what we are saying today and what we are starting today is a landmark study, and it will understand the lifestyle, environment and genetic basis of chronic diseases, not only in Goa, but it would contribute to India specifically. Whatever we learn from here, it will contribute to the India and then also globally. Because there are many exposures which are very particular to the Goa and which are not present. We can't study some of these exposures outside Goa. So therefore this study is very important. Some of the prevalence of the exposure is very high that we have to study. So for example, just last week, Honorable Prime Minister Mr. Narendra Modi, while speaking in Gujarat, said that the obesity prevalence is very increasing, and he also suggested that we have to reduce the oil consumption and this thing to control the obesity. So that's a one very important message that he has given and showed the concern about obesity. And in Goa, I assume that the obesity is one of the very big problems. You know, the very large proportions of individuals have the obesity. And what this study will do is when we will measure the obesity at the longitudinal different points of the time, we can actually identify what could be the biomarkers to prevent obesity also. So there could be not only the environmental factors, but there could be the genetic factors also. So once we identify those factors, this will help and facilitate to develop some precision medicine to control the obesity. So this is the potential of the study. I am talking about the potential. Similarly, just I think 1 month back, the Prime Minister of India launched his Genome India project. So in Genome India project, they had 10,000 sequence data, and out of that 5,000 it is open source data is available. But in that Genome India, the Goa is hardly represented because it's very small state, but it has a very huge genetic diversity in Goa. So I think, so if you have the 1,000 genome Goa project somewhere, which is possible here potentially, then you can have very sequence which is done from the Goa, and which could contribute to whole Genome India project, the contribution of the Goa thing, that could also be done. The third very important aspect which I see here, the potential, is to detect the chronic diseases early. Because in this project, what we are going to do is we are also doing the biochemistry evaluation at just time of the blood collection. So we are not only storing the blood samples in the biobank for longer time, but immediately we will do the lipid profile and the renal profile of the individuals. So this gives the opportunity to immediately tell the individuals that you have probably the early signs. Similarly, in this cohort, we are also screening for the oral and the breast cancer. So this will also help us to detect the early cancers. So even before we do the follow-up and even before we get some linkages of the risk factor study, there is an immediate intervention should be possible, which would be also very helpful. So when we do this study and when whole machinery is moves to formulate this cohort thing, it will be very good community interactions and good community participation will be there. And because we are giving the biochemistry reports to them, immediately they will be benefited for the intervention. And this process will also help to build up a good follow-up system by the passive follow-up. So, and then this will helpful for developing a good electronic medical record maybe. So we can identify the areas where we are lacking at this time, because we want to move towards the digital India. We want to make our medical record completely digitalized and electronic. So maybe when we do the project and when we start doing the linkages, we will identify the areas where the electronic medical record needs to be strengthened and build up an IT infrastructure to have the good electronic medical record. And then there could be a large amount of downstream applications would be there.
I personally feel the study is going to help us a lot, especially when we get such a big load of cases in my tertiary center. So if prevention component is brought in very actively in Goa health system, I think our cases where we get nowadays we are getting very young people, young patients with myocardial infarction, basically because of this food habits. Maybe some of them they are brought dead at the very young age, and we sometimes are left with a lot of puzzles as to why at this young age somebody's heart should fail. So we don't have systematic study. We have is the data that myocardial infarction is troubling the younger age group. Further, the main objective, the primary objective of this study is to see if there are modifiable risk factors. and if they can be modified, then we could have a healthy population in Goa. I hope this study will address all these issues, and my best wishes and my full cooperation for this study. Thank you.
Thank you, Doctor. Now I request respected Chief Secretary, sir, to say a few words.
Good morning, sir. This is a very good initiative from the public health point of view, because it helps in early intervention. So as we know the disease burden prevalent in Goa, but what we do not know is the exact etiology or the causative factor, be in terms of lifestyle issues or environmental or genetic factors. So this study will help us to pinpoint that particular thing and then devise early intervention measures, and this study should be taken forward so that we have a good database for the future, and we can also devise public health programs based on this particular study. So with these few words, I will just...
It gives me the immense pride to acknowledge the commendable efforts being taken to launch the large scale of the longitudinal cohort study in Goa. This initiative is a major step in our commitment and efforts towards enhancing the public health, and will play a pivotal role in identifying, preventing and mitigating the risk of non-communicable disease such as cancer, cardiovascular disease, diabetes, the kidney disease. The rising burden of non-communicable disease is one of the greatest healthcare challenges facing not just in India but the world. As the Chief Minister of the state, I am deeply committed to ensuring that every Goan receives the best healthcare services backed by the data-driven policy and scientific research. I am certain that this study will help us in understand the health trends specific to Goa's population and enable us to develop the targeted healthcare intervention. These initiatives will bring the multiple benefits to the Goa and serve the model for the public health research in India. Some of the key outcomes: public health impact. By studying the prevalence and determinants of the non-communicable disease, we can introduce the preventive healthcare strategies to improve the overall well-being of our citizens. Policy development. The study will generate the evidence-based recommendation that will guide our state's health policy and optimal resource allocation. Third one is the Goa-specific data. By assessing the dietary, environmental and genetic factors unique to Goa's population, we can design tailored healthcare initiatives that strategically address the individual challenge of the local public of Goa. Global collaboration. The partnering with the Oxford University and Tata Memorial Hospital, to strengthen our research credibility and open the door for the advanced medical studies in Goa. Capacity building. This study will enhance the local research capabilities as well, creating the skilled workforce in epidemiology, public health and medical research. I extend my heartfelt gratitude to Dr. Rajesh Dixit, Director of the Center of Cancer Epidemiology, Tata Memorial Hospital, and Dr. Sharayu Mahatre, the Scientific Officer of the Scientific Expertise and Commitment to shaping this groundbreaking study. Professor Sara from the Oxford University for being the part of this MOU and leading the Oxford globally recognized the expertise in epidemiology and statistics analysis. Your involvement ensures the high academic rigor and credibility for this research. With Tata Memorial Hospital and Oxford University as a key collaboration, Goa is now at the forefront of the public health research in India. This study will not only impact Goa but set a precedent for the similar research across the nation. Under the dynamic leadership of Honorable Prime Minister Shri Narendra Modi ji, India's healthcare sector is undergoing the historic transformation. His vision for the universal health coverage is being realized through the landmark initiatives that have made the qualitative healthcare more accessible and affordable for every citizen. One of the most impactful healthcare reform introduced by our Honorable Prime Minister is Ayushman Bharat, which aims to provide the holistic healthcare coverage across the primary, secondary and tertiary care. As a government, we are fully committed to provide the necessary resource, expertise and infrastructure to ensure the success of this landmark cohort study. We will make the special budgetary provision to support this research. The study findings will directly influence the Goa health policy, allowing us to take the proactive measures against the non-communicable diseases. We aim to make the Goa as a leader in public health research, contributing to significantly in India's healthcare advancement. I once again commend to the Director of Health Services for their vision and leadership in spearheading these initiatives. I extend my deepest gratitude to our partners from the Tata Memorial Hospital and Oxford University for their support in making these initiatives as real. Once again, congratulations for both the organizations for supporting of the government of Goa.